The claim cost arc is really a personification of the game phases, if you will, of a member and a provider's journey in healthcare. They have three phases: that before treatment happens, or prospective; while treatment is occurring, concurrent phase; and then you have after things have occurred. It's the retrospective phase of treatment. The member is a central figure in the claim cost arc. Everyone else has to be aligned and supporting for the success of that member's journey. Prospective phase example: do you have a good plan design? Does the member understand the plan design? Do they know where to seek treatment? Do they understand how to get help if they don't? Then you get into the concurrent phase. Am I at the right provider? Am I getting the right treatment? Is there a different or alternative treatment that's being recommended? And the provider needs to be a part of that, and the plan needs to be a part of that. And then you go to the retrospective phase. There's more the administrative process of adjudicating the claim, making sure that the provider is billed properly, making sure that the service is received where everything that was promised to the member, making sure that the plan understands what their responsibility is, the provider understands how they're getting paid. And another piece of this for the conversation has to be around the use of data. Data is a critical force in the successful transformation of bringing members and plans forward into the future. It's all tied to transparency.
Yeah, I think that one of the fundamental flaws across our industry is the lack of data, the transparency of data, how data is used to make better action items in decision-making processes. On the front end, looking at a plan's design, taking in and adjusting their paid claims information to identify what the cost drivers are, where the members are seeking care, what the areas of opportunity are on the front end, leveraging that information from a stop-loss plan design perspective to implement cost containment strategies within the plan document, what you do with that information. So it's all flowing into the single data warehouse. So you don't have a fragmented program that has one care vendor, has one network vendor, has a TPA administered. So really bringing those different pieces together.
You end up with a single stream of data that flows into a single repository captured in your data warehouse, where you can see every phase of what went on and begin to identify patterns that allow you to make better decisions. So that's how we look at the claim cost arc. And we call it an arc because really, if we're doing our job properly, we're going to begin to tilt spend down like an arc and begin to get that impact on overall cost to help the plan provide greater service at a lower cost to members who will have greater service at a lower out-of-pocket, to providers who understand what reasonable reimbursement looks like and accept it as payment in full. That's our claim cost arc.